of testing should take place before choosing a therapy for small cell lung cancer?
In general, patients will need a diagnosis, so they'll need some kind of biopsy, and then this tissue sample is looked at under a microscope, and a pathologist calls it small cell lung cancer. Then they need scans to establish a clinical stage. This is usually done through a PET-CT and an MRI brain. However, small cell lung cancer can be quite aggressive, and a lot of times patients are in the hospital for symptoms directly related to their cancer. In those circumstances, especially when patients are very symptomatic, it can actually be reasonable to start with treatment initially and get scans as soon as possible. In certain circumstances, an additional step can be taken, which is called molecular testing. This is not routine for patients with small cell lung cancer. However, if a patient has never smoked in their life, I will frequently get what's called broad-based molecular testing, because a lifelong never smoker might have certain mutations that allow the use of a different type of treatment called targeted therapy, and can also provide information for possible clinical trials in the future.
How is small cell lung cancer treated? What are the options for patients?
The mainstay of treatment in 2025 is using chemotherapy. We typically use a combination of platinum chemotherapy. Your doctors might use a drug called cisplatin or carboplatin. These are platinum chemotherapies, and it's typically combined with another chemotherapy called etoposide. In addition to those treatments, especially if patients have widespread small cell lung cancer, it's very common to also add an immunotherapy treatment to the chemotherapy. These are often given in 4 cycles, and a cycle is defined as 21 days spaced apart. And after the completion of chemotherapy and immune therapy, the doctors will frequently get repeat scans to see if the treatment has worked or not worked. And then patients will go on a maintenance program where they're just getting the immunotherapy.